welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman. Let's look at today's top headlines. Negligence in post-operative care, anesthetist suspended in Tamil Nadu. The significance of post-operative care has always been immense, yet commonly left out in the private sector or even in the government sector. The importance of post-operative care was recently pointed out by the Tamil Nadu Medical Council when it suspended an anesthesiologist of Erode-based Kumaraswamy Hospital for a period of 6 months. This anesthesiologist left a patient unattended for around 15 minutes after the lower segment cesarean section. Council also counted lapses on the part of the gynecologist Dr. Sangeeta, who left the patient at the care of the anesthesiologist Dr. Thangaraj before recovery from anesthesia. She has been left with a warning. Council opined in its order endorsing the views of the anesthesiologist specialist and came to the conclusion that the patient was probably unmonitored for 15 minutes after the surgical procedure and the unnoticed anesthesia-induced hypotension has led to cardiac arrest, and anesthesiologist Dr. Thangaraj was negligent on his duties and not monitored the patient properly for about 15 minutes and thereby failed in his legitimate duty to attend the patient. While the council did not find any fault on the gynecologist's part during the operative procedure, it pointed out the lapse while providing post-operative care to the patient and noted that Dr. Sangeeta ought not to have left the patient without full recovery from anesthesia and shifting the patient to the post-operative ward. Had she remained with the anesthetist, she could have helped him to revive the patient in the emergency situation. It was a 22-year-old patient who was admitted to the Kumaraswamy Hospital for delivery and she expired. The council also found several other lapses. The case sheet was not documented properly, the availability of supportive documents was not there, cephalopelvic disproportion should have been assessed earlier, the progress of labor was not monitored, and post-operative monitoring was also inadequate, etc. After the inquiry, the council opined that the possible cause of death was spinal hypotension leading to cardiac arrest or stress cardiomyopathy or pulmonary embolism. Whatever may be the cause of death, but the post-operative monitoring was inadequate and even if done, was not documented. Therefore, the name of Dr. Thangaraj was removed from the medical register of Tamil Nadu Medical Council for a term of 6 months. It was made clear that Dr. Thangaraj should not practice modern medicine during the period. His name was erased from the medical register of Tamil Nadu Medical Council and he was directed to surrender his original registration certificate to Tamil Nadu Medical Council immediately. Dr. Sangeeta was warned to be more careful in future. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.